Children's Specialized Hospital in King Fahd Medical City, Riyadh of Saudi Arabia. In the NICU department, we have a 44-bedded tertiary care neonatal intensive care unit. Our mission is dedicated to provide the best specialized healthcare, research, training, education, and human resources development in a family-centered and developmentally supportive environment with honesty, loyalty, and teamwork. We are dealing with all cases of tertiary care neonatal diseases, where we go down to 23 weeks, 500 grams of premature babies, and all cases of surgical neonatal ICU, like diaphragmatic hernia, CCAM. We have all the equipments and the manpower necessary to do so. Whenever the tertiary care need for our babies is over and babies are getting well, we have our partner of secondary hospitals for continuity of care. We transfer those babies in a very meticulously and in a very clear process, where we have a lot of people involved in this process, starting from nominating the babies who are going to be transferred till the actual transfer itself.
A case manager rules started after the decision from the medical team to transfer a particular patient.
The respiratory therapist rule when the patient in a neonatal intensive care unit is ready for transfer and transport. First thing, the respiratory therapist will check the patient's stability, and also he will check what modality that the patient is receiving. Either is it oxygen therapy, is it non-invasive ventilation, or if the patient is intubated and mechanically ventilated.
First, the medical report have to be issued from the attendance consultant.
Both inter-facility and intra-facility patient transfer are crucial in neonatal ICU. It must be organized and regulated procedure to ensure the safety and efficacy of the process. All transfer from neonatal ICU should be arranged between NICU team and the receiving hospital based on a detailed medical report generated from database and signed by the treating physician who is involved in the treatment of the infant.
After that, coordination have to be done to allocate the suitable facilities to transfer a patient.
After checking the stability of the patient, the respiratory therapist will assure that the patient will have his emergency equipment with him for the transfer and transport, which consists of the amber bag, mask, and the airway. And also, he will take a note of the setting of the mechanical ventilation if the patient is already on mechanical ventilation and ventilated, and assure that he will make the same barometer on the setting on the portable transfer with the incubator.
Second, family member will be informed before the transfer.
In EMS, we receive a call from an ICU nurse that there is a patient to be transferred to other healthcare facility. In order to prepare for transfer, a document will be sent through the email, and the medical record will be reviewed. Then we will have to respond to an ICU unit to take care of the patient and transfer him to our incubator, transporting incubator.
After this, the patient will be placed on the incubator and will hook him to the ventilators, and the respiratory therapist will make the setting, and after this will confirm the setting of the mechanical ventilation with arterial blood gas or non-invasive monitoring, like for example checking the intadal CO2 or the intadal CO2. The full report will be given from the respiratory therapist to the EMS team, who will take care of the transport of the patient, which is mostly will consider this report will consider the size and the level of the AT tube that the patient is on, and also the latest ventilator setting on the portable ventilator, and the latest blood gas, if any, or a reading for the non-invasive monitoring for the ventilation and the oxygenation.
Upon transferring our babies to the secondary hospital, this is not the end of the story. In fact, this is the beginning of the story, because we will continue following up our babies in their secondary hospitals. We will bring them back in case if they need any tertiary care service, and upon discharge from the secondary hospital, they will be still follow up with us.
أنا أم فيصل، حابة أشكر جميع القائمين على رعاية ابني، ولقد تم إبلاغ زوجي أن ابني سوف ينقل إلى مستشفى آخر، ولقد تم إعطاء جميع المعلومات اللازمة وموقع المستشفى عن جميع المواعيد التي أحتاج أن ألتزم بها.